So welcome to the Kanski lecture series uveitis part 5, and in this part we are going to study about the uveitis in a bowel disease, which is basically the inflammatory bowel disease, ulcerative colitis, and Crohn disease. Ulcerative colitis. Ulcerative introduction. Ulcerative colitis is an idiopathic chronic relapsing inflammatory disease involving the rectum and extending proximally to involve part or all of the large intestine. So basically colon is that the distal part of the intestines. So in this part, ulcerative colitis, there are the inflammatory lesions that develop in the rectum and the part of the colon or all of the large intestine. The disease is characterized by contiguous surface ulceration and the bowel mucosa with the development of the crypt, abscess, and the pseudopolyps. So in this, basically the ulcers are formed and in the bowel mucosa, and there are crypt, abscesses, and pseudopolyps. Long-standing disease carries an increased risk of carcinoma of the colon. A genetic predisposition is thought to be important, as inflammatory bowel disease is more common in patients with other autoimmune disease such as AS, ankylosing spondylitis, psoriasis, and multiple sclerosis. What are the systemic features of the ulcerative bowel disease? And then there are ocular features. Presentation is in the second to third decade with the bloody diarrhea, lower abdominal cramps, urgency, and tenesmus. Constitutional symptoms include tiredness, weight loss, malaise, and fever. So there is going to be diarrhea, which is lower bloody diarrhea. There are going to be the lower abdominal pain. There are going to be the urgency to evacuate. There can be the tenesmus, and other symptoms include tiredness, weight loss, malaise, and fever. So there are going to be some cutaneous lesions, include oral aphthous ulcer, erythema nodosum, and pyoderma gangrenosum. Arthritis is typically asymmetrical and involves large joints of the leg. Sarcoileitis and ankylosing spondylitis may develop in HLA-B27 positive patient. Hepatic disease may be in the form of autoimmune hepatitis, sclerosing cholangitis, and cholangiocarcinoma. Thrombosis may affect both arteries and veins. So there can be hepatitis as well, which include hepatitis, cholangitis, cholangiocarcinoma, and there can be thrombosis, which may affect both arteries and veins. So there can be ocular features. AAU occurs in about 5% and may coincide with the exacerbation of colitis. As expected, uveitis is more common in patients with associated arthritis, ankylosing spondylitis, and HLA-B27 positivity. So basically, acute anterior uveitis occur in 5% of the patient of ulcerative colitis. Other ocular features include conjunctivitis, episcleritis, scleritis may be all more common than in general population. Crohn disease. Crohn disease is an idiopathic chronic relapsing disease characterized by the multifocal full thickness granulomatous inflammation of the intestinal wall. So in this case, Crohn disease, all of the parts of the intestines can be expected. It most frequently involves the terminal ileum and colon, but in contrast to ulcerative colitis, any area of the intestinal tract, including the mouth, may be affected. There is a strong evidence for genetic etiological components such as mutation in the CARD15 previously non-2 gene. An effective agent almost certainly play a role. So what are the systemic features? So this is the ulcerative colitis picture 12.16. It shows a barium enema showing pseudopolyps. So this is a pseudopolyp, and lack of pseudopolyposis, lack of hastral markings, and straightening of the ascending colon. So the ascending colon is straightened up. Pyoderma gangrenosum. So this is a cutaneous lesion. Next is the systemic features in the Crohn disease. Presentation is typically in the second and third decade with abdominal pain and diarrhea, weight loss, fever, vomiting, oral aphthous ulcer, and perirectal lesions such as abscesses and fistula may occur. So in this case also, what will happen? There are going to be pain, there are going to be diarrhea, weight loss, fever, ulcer, perirectal lesion, abscesses, and fistula. Cutaneous lesions include erythema nodosum and pyoderma gangrenosum. Uh, Anemia is common. Hepatic disease may occur. Skeletal features include finger clubbing, acute peripheral arthritis, sarcoileitis, and ankylosing spondylitis. So let's see about the cutaneous lesion, which is 12.16b. So this is a pyoderma gangrenosum. Approximate ocular features approximately 12% of the patient with Crohn's disease experience some form of ocular inflammation. Acute anterior uveitis occur in 3%. Other manifestations include episcleritis, scleritis, follicular conjunctivitis, myositis, and optic neuritis. Whipple disease. Whipple disease, intestinal lipodystrophy, is a rare condition, chronic gastrointestinal inflammatory condition caused by infection with the bacterium Trophiema whippleyi. It occurs mainly in the white middle-aged men, and when diagnosed, duodenal biopsy, DNA detection in blood, ocular and other fluids can be cured with antibiotics. So basically, this is a condition which is usually affected by an infection known as Trophiema whippleyi, and it is middle-aged men, and they are diagnosed, can be cured with antibiotics. So what are the systemic features? They are going to be the inflammatory bowel disease with malabsorption, joint, cardiac, and central nervous system involvement is common. Ocular features uveitis, keratitis, anterior uveitis, vitritis, retinitis with retinal hemorrhage, cotton wool spot, and potentially vascular occlusion and multifocal choroiditis. So these are the ocular features that can occur with the case of Whipple disease. Then very important is the neuroophthalmic manifestations can be varied. For example, gaze palsy, nystagmus, ophthalmoplegia, papilledema, optic atrophy, oculomesticatory myarrhythmia is characteristic. Next is the uveitis and the renal disease. So it's include TINU, which is a tubulointerstitial nephritis and uveitis. Tubulointerstitial nephritis and uveitis is TINU is uncommon disorders of immune origin characterized by a combination of acute tubulointerstitial nephritis and uveitis. It typically occur in adolescent girl. Renal disease usually precede uveitis. So first they are going to be the renal disease, and then they are going to be the uveitis, and it occurs in the adolescent girl. Systemic features: presentation is with constitutional symptoms, proteinuria, anemia, hypertension, and renal failure. The response to the systemic steroid therapy is good, and renal function usually returns to normal within few months without complications. So there can be the renal problems. They are going to be the proteinuria, anemia, hypertension, renal failure. Ocular features include bilateral non-granulomatous, occasionally granulomatous anterior uveitis that usually respond well to topical steroid. Disc and macular edema may occur. Many cases are relapsing, and some require systemic steroid or immunosuppressive therapy. Intermediate posterior or panuveitis may occur. IgA nephropathy. IgA nephropathy, Berger disease, is a relatively common kidney disease in which immunological A is deposited in the glomerular mesengium. Presentation is usually in 16 to 35 with recurrent hematuria, often associated with upper respiratory tract infection, but may be asymptomatic. Acute anterior uveitis and other ocular inflammatory phenomena may occur but are uncommon. So basically, IgA nephropathy is also a renal disease in which the IgA is deposited in the glomerular mesengium, and these are presented in 16 to 35, and they're going to be the hematuria and upper respiratory tract infection. In case of ocular feature, acute anterior uveitis can occur with it. So that's it for the uveitis part 5. See you in the next.